have folks coming into the room now, Tori. I see folks. All right. Good morning, everyone. We are so excited to have you join us today. We'll take just a moment as people continue to come into the room with us. Good morning. We see people starting to talk in the chat and say good morning to one another. It's wonderful to have you all here. What, as you start to come in, if you want to pop in the chat, which would be wonderful, we'd love to have you pop in your name, your affiliation, and one word that describes why you care about teen mental health, because that's what we are all here for today. So please go ahead and pop that in as we go through, and we'll allow people to look at that a little bit. We have about 100 people registered for today, so we'll give it just another moment as people continue to come in. And I do want to note for people that we are recording today's webinar. We know we have some people who wanted to be here with us who can't, and we want to be able to share this with more people as well. So just so that you are aware. All right, we'll go ahead and jump in. So good morning, everyone. I am Allison Williams, and I have the amazing fortune of being Wyman's current CEO. At Wyman, we connect teens to their voices, their strengths, and their futures through proven programs and supports. Our three programs, Wyman Leaders, the Teen Outreach Program, and the Teen Connection Project, are all proven by external research to build the kinds of skills we know help young people thrive: educational and career success, life and leadership skills, and healthy behaviors and relationships. We are proud to deliver these programs to 1,200 young people in our hometown of St. Louis, Missouri. And through 70 plus partnerships across the country, another 24,000 young people receive our Teen Outreach Program and Teen Connection Project. And we are now in our 128th year of doing this work and having a commitment to young people. So we envision a world in which all young people thrive, and with a commitment, especially on the teen years. And by that, we mean middle school, we mean high school, we mean those late, early, young adult years as well. We have chosen to spend May as Youth Mental Health Month, raising awareness and elevating actions around the importance of upstream youth mental health programs. Today, we are so grateful to have with us Allison Neiman, Chris Lewis, and Allie Farrell to join us for an engaging conversation. I think you'll hear today these are three amazing and inspiring leaders whose organizations all share a deep commitment to teen mental health. And we'll do a deeper introduction in just a moment. And when I say join us, I mean join us. I mean this entire community who is with us here today. On today's call, we have practitioners to policymakers, to philanthropists, to governmental funders. We have people who work in K-12, community-based organizations, governmental organizations, and higher education. We have researchers, we have parents, aunties, grannies, we have authors, we have board members on. We welcome all of you here, and we appreciate you again taking a moment to just drop into that chat your name, your affiliation, and one word that really speaks to you when you think about why you care about teen mental health. So today we'll start by setting the stage for our conversation. What do we mean by upstream youth mental health? What are the realities that young people are facing? And really importantly, what are young people's perspectives on this? We'll then hear from Allison, from Chris, and from Allie. We'll have some space for your questions, and we'll leave you with some calls to action and some follow-ups and things that you can immediately do. So first, upstream teen mental health. What do we mean by this? So my friend Chris Lewis from Chiron Community Giving Foundation, and I love this quote, she talks about the things that aren't therapy, but are therapeutic. Mindful Philanthropy uses the word flourishing. The Children's Funding Project and Fund IRL focus on youth well-being and healthy development. Our recent Surgeon General, Dr. Vivek Murthy, talks about a triad of fulfillment for humans: healthy relationships, a sense of purpose, and connections to our community. We've all heard the words in youth mental health and social work speak around prevention, around being proactive, around what can we do that are universal for young people. And really importantly, we know that every adult in a young person's life has an opportunity to positively impact their mental health and well-being. So Upstream really reflects the approach that we take at Wyman and that we've taken for the last 128 years. And I'll share an example of how this works through our Teen Connection project. This is only one example. We know there are so many powerful programs out there. So through the Teen Connection project, we have been able to document through our research positive mental health impact because of a baseline of experiences we bring to young people. And these are high school students in particular. So by bringing small groups of high school students together on a weekly basis over the course of a regular semester, 12 weeks or so, by providing during those times, and this is not a clinician who runs this, this is any adult, well-trained adult who cares deeply about young people. That's who can lead the Teen Connection project. By providing engaging experiences to deepen relationships and connections with their peers during that time. By creating a safe space where young people can practice and experience that depth of relationship. And by challenging young people to take these skills outside the group. Our research has shown us that 4 months after the program's completion, so we know this has stickiness, young people in the program had lower rates of depressive symptoms, higher use of social coping strategies, stronger peer connections, and a stronger sense of belonging to their schools. And all of this through a program that could be implemented over the course of 12 weeks in a very straightforward way. We were so moved by the impact of this program, and quite frankly, the response of the young people to the program and the adults who ran the program, that we're on a journey to reach 100,000 young people over the next 5 years through the Teen Connection project. And that happens through partnerships and training with others. So that's what we mean as an example of upstream youth mental health programs. Secondly, why does this matter? We think a lot at Wyman about 4 really unique circumstances that are shaping the growing up time right now, right, of the young people who are in K-12 and in the space of early adulthood, whether they're in higher ed, whether they're navigating the job market. So first, due to the pandemic, at some point in their lifetime, these young people have had 2 years of interrupted typical developmental experiences. Connections, community, the things that we know are so critical to healthy youth development were impacted. This doesn't make our young people wrong. This means that they have had a profoundly different experience, and that has an impact. And by the way, the adults who cared for them during this time had those same impacts, right? Both that disrupted community and connection, the trauma that many of our young people experienced in losing key family members, watching what was happening, and just simply the general community trauma that occurred as we all went through that together. Secondly, we know that even 10 years prior to the pandemic, mental health indicators for adolescents were moving in the wrong direction, and this got amplified by the pandemic itself. Third, we know that this generation, this is the first time that entire generation, right, has had access not only to use technology and to have technology a part of nearly every aspect of their lives, but we are now in a space where young people can have a relationship with technology via AI. And again, this is occurring at a time when foundational human-to-human relationships are absolutely core and fundamental to healthy development. Lastly, and I probably don't need to say this to the people on this webinar, you know and understand this, we are living in an incredibly uncertain time, a time with increasing inequities, a time with changing policies that are often not favorable to healthy development. And yet our young people going through this time, especially our teens, they're in a space of discovering themselves, of figuring out what is relevant for them in this world, what are they doing in their futures, and they're doing all of this this in the midst of a time that is perhaps more uncertain than anything that we've seen, certainly in my lifetime, and I'm in my mid-50s. So these four unique realities for young people, these are true. These are defining for their generation. And the piece that we also know about young people, when we bring together the types of supports and opportunities that we know can be impactful and support their healthy development, they thrive, right? So this is not a doom and gloom message, but this is a message that things are different right now. So what does that mean? And what is our role in ensuring those supports and opportunities are there to support young people's thriving? So lastly, as we set the stage for today, we want to make sure you are able to hear from young people themselves. So you are about to hear a clip. The amazing humans you are about to hear from have all participated in Wyman's Teen Connection project at University City High School here in St. Louis, Missouri. We asked them to share their thoughts on teen mental health and what they wanted adults to hear. This is unscripted. This is their truth. These are their reflections having gone through this program. So please go ahead and play the video.
Adults also need to talk about mental health.
Times are changing.
The workload that teenagers have is insane.
We gonna get into like the real world.
Yeah. My name is Caleb.
My name is DeAnton.
Hi, my name is Makisha.
Hi, I'm Michaela.
Hello, my name is Lyric. My name is Jordan Jones.
Hello, my name is London.
And my name's Casey.
And I'm Jordan, and welcome to TCP Mini Mic.
What is one challenge you think teens are facing today when it comes to their mental health?
Just not knowing the right person to talk to at the moment.
Like fitting in with a crowd that they want, because trying to chase religion, but also trying to still fit in with your social group.
The stress and like figuring out what you want to do after high school could be very stressful.
Stress over like homework and stuff. And also knowing who to talk to. A lot of teenagers do not have therapists.
Another challenge is expressing themselves.
How do you cope when you're facing a challenge?
So I usually just go listen to music, or I'll talk to you, talk to some other friends, talk to my mom. Music is a very healthy way to cope.
I like to draw a lot or play like The Sims.
Step away from the challenge just to kind of reset my mind and then go back to it. Because a lot of the times when I face a challenge, it's because I'm trying to do too much.
I would say definitely take some time to figure out like how can I handle it. Because if I don't, then I'm just going to get much more frustrated and it's just going to get worse.
Okay, how can adults support teen mental health? By doing stuff like TCP and what Wyman does for us, just giving us groups to talk to and connect with each other.
Basically listening.
Being an outlet. If your kid needs to vent, just listen.
Just making it comfortable for them to talk to you about it without feeling like they're going to be judged.
People would say listen, but also commitment. If you say you're going to help me, you have to prove that you are.
You matter.
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 You matter. Yes, you boo.
All right. Yeah, I see some pieces in the chat. Candace, I love this as well. And truly, as you heard, London and Casey and Jordan and Mikesha and Lyric and their peers speaking, again, that is their truth. Those are their words. And that's absolutely what we should be grounded in as we start today's important conversation. So before I jump into introducing the panelists, just a reminder again, if you haven't done so, please go ahead and drop your name, your affiliation, and one word in the chat that's about your why. Why are you invested in teen mental health? Why do you care about this? So that brings us to today's conversation. So we're so excited today to be bringing together three different organizations: Mindful Philanthropy, the Chiron Community Giving Foundation, and the Children's Funding Project and the Fund IRL Coalition, who will guide us through a discussion on their unique approaches to fueling investments in upstream youth mental health services. This conversation is meant to be generative, and you are more than welcome to drop questions in the chat for some Q&A at the end. We'll pull some of the questions, we'll pull from those themes and make sure you have an opportunity for that. So we're thrilled to have with us today Allison Neiman, the CEO of Mindful Philanthropy. We became aware of and affiliated with Mindful Philanthropy a couple of years ago when they were doing a search for programs that they saw that were impactful. And we were thrilled that they inquired more about the Teen Connection Project, and we've had great conversations since then. And we really, really admire the amazing work that's being done in that space. You'll hear more about that. We also have with us Chris Lewis, who's the president and CEO from the Chiron Community Giving Foundation. They are focused specifically on the St. Louis, Missouri region, and Chiron has supported our growth efforts with Teen Connection Project for several years now, and she and her team and the other partners they bring together have been amazing thought partners in this work and what's happening in the region. And then we have Allie Farrell, the Director of Strategic Initiatives, who is joining us from the Children's Funding Project in the Fund IRL Coalition. Wyman joined the Fund IRL Coalition, I think it was last year, Allie. She'll talk more about that. And we have joined this and we have been sharing blogs. We've been sharing more about the Teen Connection Project as an example of one of many ways that upstream youth mental health can be supported, and why funding IRL is in real life is so absolutely critical. So now here's what you really came for. I want to start with our three panelists, and we'll ask each panelist to share two things. And we're going to start with Allison, then move to Allie, then move to Chris. So Allison, first, can you share more about Mindful Philanthropy's why around upstream youth mental health, and an overview of your approach? Why are you taking the strategy? And each of our panelists, you can have 5 minutes or so to talk about this, whatever you need. We really want people to understand the foundation here.
Great. Well, thank you, first of all, Allison and the team at Wyman, for having me today. I'm thrilled to be here. And my personal why is I'm a mom of two teens, and so I come at this work from a vested interest in seeing kids thrive and be connected. And Mindful's mission, for those of you that don't know, is to increase impactful funding to mental health, addiction, and well-being. And so not only are youth the future and incredibly strategic, but everyone knows a youth, whether it's a daughter, a granddaughter, a niece, a son, whoever it is, and we care deeply about them. We want them to thrive and flourish. It's something that we can all agree on right now, especially in this time where we have so many different perspectives. And at Mindful, our why around upstream prevention of youth mental health is really simple. It begins with an urgent realization that youth mental health does not begin in crisis. It is not the absence of mental illness, but it actually is the thought, the perspective, the goal that we want youth to flourish, every single youth. And in Mindful's network, we have a network of 1,300 funders, and over 85% of our funding network is either actively funding youth mental health or trying to fund youth mental health. They're looking for ways that they can be impactful and strategic with their dollars. And so we know that mental health and youth in particular do not flourish because of one intervention or because of even one single relationship. It actually is a continuum where mental health is shaped over time through relationships, environments, connection, belonging, and opportunities to grow. But most of our systems, as we know, as any of us have encountered systems, they are actually structured around and organized around responding to distress or treating illness after things have already escalated. And so our goal is to start shifting this conversation more upstream. And we believe that philanthropy has a unique opportunity to do this, and frankly, a responsibility to do this, to help shift the field upstream around youth mental health. That prevention is not age 10, it's actually starting at 0. and with the mom in particular, as we think about, or caregivers, whoever that might be, the father, the mother, any caregiver that is in a child's life. And so this means investing earlier and more intentionally in the conditions that help people flourish before crisis emerges. So we are in the process of launching an initiative called Flourish Together. In fact, an upstream blueprint for philanthropic investment will be out later this month. And the approach focuses on three different areas that are interconnected. The first is what we call Strong Start to Life, and it's supporting caregiver well-being, infant mental health, and those early relationships during critical developmental years. The second of those interconnected areas is something we're calling Play and Grow, and it's expanding access to things such as arts and sports, recreation, nature, and relationship-rich environments that build agency, belonging, resilience, the things that we know are protective factors and that help kids thrive. They help them know how to flourish when they're encountering mental health challenges. And then finally, the third area is digital well-being. And this is helping create a healthier digital ecosystem that supports connection and belonging and development while reducing preventable harms. So all three of these areas are built on five blocks, building blocks is what we call them, that I mentioned earlier: the strong relationships, the belonging and connection, the regulation and healthy development, the healthy environments, and early support and equitable systems. And we know, as I'm going to talk about later, that upstream investment is effective and it's sustainable. And so we are calling on all of philanthropy. So no matter what lens you come to youth through, that we would help align on the outcomes that will enable youth flourishing, because we believe that we can do better. And then this is our promise to the next generation. So we're thrilled to be launching the blueprint, to be shifting the conversation more upstream around youth mental health.
Thank you so much, Allison. I can just even see in the folks that I can see on this kind of, lights going off for them. And part of what I love, part of what you talk about is you talk about things like play, relationships and connection, belonging, and things that I feel like, in so many ways, it's like, yeah, that's the stuff over here. But really, tell me how they're doing in school, or tell me, did they graduate, or tell me, did they get the good job? But there's a foundation that we're missing if we just jump to that. And for too long, those are the things that they've been seen as soft. They're not prioritized. So I appreciate what you all are doing in really helping to change the narrative on that and what it means to human and what it means to flourish. So we're going to jump over to Allie Farrell, Children's Funding Project and Fund IRL.
Hi, thanks so much for having me. I'm so grateful to be here representing Children's Funding Project, and doubly excited because Children's Funding Project is a national organization, but I live here in St. Louis, so I'm really excited to be finally on a call with a bunch of St. Louis folks as well. But so if you're not familiar with Children's Funding Project, we are laser focused on the money going to children and youth. So really the public dollars supporting programs and services for children and youth from when they're little to when they're big. And we're really grounded in this cradle to career pipeline, that there's all of these supports and opportunities that young people need as they're growing up, and that those things should be a public good that are supported by public investment. And that to see young people thrive, we need to have coordinated, equitable, sustainable funding, public funding to support those things. So we work with states, communities, and Native nations, both policymakers and advocates, to do what we call strategic public financing, which is really just answering these three big questions. So the first question is, what is your community spending now on your goals for children and youth? So upstream youth mental health preventative activities, what current federal, state, and local, and even private dollars support these programs and services now? So we have different ways to map current funding. The second question we help answer is how much funding is needed to support these types of programs in full. So we do cost modeling and cost analysis to get to the big number, or the true cost of what it will take to deliver population-wide at scale and at high quality these programs, so that we're not shying away from the big numbers, and we're not going in and asking policymakers for what we think we can get, but for what it will actually take to deliver results. And the third question we help answer is once you know current investments and how much funding is needed, where's the money going to come from to fill the gap? So we do this in a couple different ways, helping research different revenue generating options and taxing mechanisms, support local communities that are going to the ballot to create voter approved children's funds. And I always feel so proud to be from St. Louis because, you know, we have two amazing examples of these funds in both the city and the county. I saw many names in the chat here today from the Children's Services Fund and St. Louis Mental Health Board, of where the voters in our community have decided that we want to invest in young people in a sustainable way. There's about 55 of these funds across the country now. Majority of them are early childhood. So communities investing these dollars in upstream youth mental health interventions and opportunities is really exciting. One of the strategies we're really excited about right now, or is really top of mind for us in terms of sourcing funding for upstream youth mental health, is potential legal settlement dollars. The Fund IRL Coalition is a coalition of partners, a couple of whom are on the screen right now, who are preparing for, with all of the thousands of social media lawsuits that are happening right now about youth mental health harms, if we are to see major payouts or settlement dollars coming from those lawsuits, like we did back in the day with tobacco and like we're seeing like opioid and Juul and other things, that these cases are about harms to youth mental health. So any funds that result from the lawsuit should be invested back into young people and their well-being and healthy development. That's not guaranteed in the past, you know, especially with tobacco. A lot of the settlement funds were filling budget holes or just going into general funds, which means they could go anywhere to roads and bridges or what have you. But we want to make sure these companies profited over young people's engagement through these platforms, and so should really go back into all of the things Allison was just talking about: play, outdoors, arts, sports, service, civic engagement, all of these upstream opportunities that are mental health. And so we're kind of the umbrella we're trying to bring us all together under is IRL, this in real life opportunities to be in relationship with one another off screens, just so that if we have an opportunity to dream big for what could be, you know, let's say billions of dollars, if we're dreaming big, to come together and define what we want that to look like and make sure attorneys generals are seeing that and making those investments. So happy to talk today about or answer questions about either Fund IRL or our work more broadly at Children's Funding Project. But thanks again for having me, Allison. And I'm happy to be an Allison on a panel of many Allisons and a Chris.
Thanks so much, Ellie. It is funny as we're about to go to my friend Chris. She said, "Well, I feel a little out of place here because I'm not an Allison." But yeah, we also have Chris's on our team, so we are good. You know, Ellie, as you talk about this, thank you so much, because I think part of what we wanted to do on this is to bring together a variety of perspectives, right? So Allison is really talking about a lot in the space of private philanthropy, right? And what is happening, what is coming together. And Children's Funding Project is not a funder and helps organizations and communities figure out how to get funding from their communities. So I love that. I love both sides of it. I also love, as you know, you talk about your focus is really on that local, on that state level, right? As these pieces are coming through. And I know there's so much angst right now around what is or is not happening to federal funding, how that trickles down to states. And rightly so. There are a lot of uncertainties right now. And part of what Children's Funding Project does is reminds us that there is power in local communities in terms of how do you come together to care about kids. And yes, huge shout out to, I think we have 7 in the state of Missouri, children's services funds. And I would be remiss if I didn't say, and Wyman is proud to be a recipient from Children's Services Fund. That's how we're able to do the Teen Connection Project at U City High School. So these types of funds are absolutely important. And we will send out more about Fund IRL in our follow-up packet for folks, because that's a space where you're looking for all comers who care about young people, right, to help tell that story. So, Chris Lewis, a great segue to you, where we have yet another very, very unique perspective. And in case you don't share this, I just want to shout out for the folks who are on with us. Chris is bringing to us such a unique perspective of having been in the education system and as an educator and as an administrator, and then moving over into the mental health system as a counselor, a licensed counselor, and now really doing this work from a foundation perspective. So you bring such a fascinating realm of experiences to this, Chris. So tell us about your why and Chiron's unique approach.
Thank you, Allison. And it's so good to be here today, seeing these words in the chat. You know, it really is about hope and the hope that we each hold about the future of our youth and what that means. You know, CCGF's mission is to foster collaboration within the community that can transform the community and change lives for people within them. And the why, in terms of the mental health initiative that we're currently working on, where we're looking to put about $8 million of investment over 10 years into the mental health systems in the area, really is everything from strategic investment in direct service to looking to foster systems change. We see our roles as educators, as professional counselors, as people who are involved in philanthropy, myself and the other leaders who are board members and consultants, as really investing in the effective work of others who are doing things on a day-to-day basis, year after year, to try to improve outcomes. And so we are looking, if we've been successful, we will have been a small part of contributing to both connecting folks who come from very different backgrounds and walks of life, and also contributing some really important voices from lived experience to the evidence base that guides the work to allow solutions to be really tailored. You know, they always say things in civic development world like, oh, St. Louis should be a great place to live, work, and play. It really is. And we know that with mental health of the individuals being a focus of everyone, regardless of their positioning. So not just the mental health agencies, not just the educators, but also those who are looking for workforce outcomes, improvements in attainment of education, and all of these arenas, that mental health of individuals matters. So one might look at this graphic and think, well, why is it that, you know, we're funding projects that have to do with maybe administrative or capacity building for youth, non-direct mental health services, not referral to service? Well, it's because we think that programs like TCP are actually access to mental health care initiatives, because ultimately, by focusing on the developmental aspects of positive mental health and well-being, we are allowing there to be additional access to mental health care services when those strategies are limiting the severity of cases, the number of cases that eventually wind up in the mental health care system. Also, as has been mentioned by others, looking at the flourishing and the ability for the well-being of youth to be impacted in this way is important. And so one of the things we try to bring to the forefront through the educational opportunities and the collaborative opportunities that we sponsor is that there's a whole realm of neuroscience and awareness of what happens when individuals are raised in situations where there's been chronic stress, where there's been trauma, and how do we mitigate those things in our roles that are non-clinical. And so providing supports and services for people to come together and discuss from a variety of different parts of the sector, whether they are providers, whether they are youth providers, clinicians, educators, how we can wrap around youth using these truths that come from research on Dr. Nadine Burke-Harris or Bruce Perry or Vivek Murthy, and surfacing those things to allow for conversation to take place that catalyzes strategic change in program and in investment.
Can see, hopefully, from listening to Chris, why Chris and her team have been such amazing and valued partners to Wyman. Not only the direct pieces we've done with Teen Connection Project, but that expansion of the thinking. And there's so much to the space that you talk about. Again, I go back to the things that are therapeutic, but not therapy. And, you speak to how many people in their roles, in their positions, working with young people, they're not clinical staff, they're not therapists. And boy, they do and can have a tremendous impact on young people's mental health. So wonderful. And I feel like Chris and Allison, there's a conversation for you. I saw Chris's eyes lighting up a little bit when you were talking about early childhood, Allison, with some of the work that they have supported at Chiron as well from that neuroscience perspective. All right, so with those introductions, let's take it a level deeper then. So, you've each talked about investing in youth mental health, and we know there are so many competing priorities out there right now. There are so many challenges. How do you see what makes investments in youth mental health really compelling in this current climate, right? People on this webinar are out, maybe trying to convince folks why is this important, or trying to help people within their system understand why is it important to advance and really adapt an upstream youth mental health perspective. What makes it compelling right now? What do you share with people? Let me start, Ellie. I'll bump that over to you because you're obviously doing a lot of public facing work trying to get people on this train.
Sure. I mean, I think it's this really unique moment. I'll talk about with the lens of the Fund IRL Coalition, this moment of social media accountability that we're seeing in the country, both through all of the lawsuits nationwide, but through, the conversations on phone bans that are happening in both at the school district level and among federal policymakers on tech regulation. It's almost like one of the last bipartisan issues we have left right now. So it's this moment where policymakers and voters across the board are kind of concerned about the power of the tech companies and the impacts of all of us. It's so deeply personal for all of us, our relationships with screens and with social media. So sort of the messaging power there is we're talking a lot about what we're taking away from young people, like let's do a phone ban, let's take things away, where everybody's trying to meet developmental needs as they're growing up and using the tools they have in front of them. So if we're taking things away, what as a society are we putting back in? An abundance of programs and opportunities and experiences to connect with peers and caring adults. Like that's not accessible for everybody. I don't know if people saw yesterday, the latest version of the America After 3 p.m. survey came out from After School Alliance. And the results from yesterday were specifically about summer opportunities, which again is top of mind for everybody right now. And I pulled some stats. Like it said, parents of 24.6 million children want them in a summer program, but 1 in 2 are missing out. So, over 10 million are missing out on something to do this summer. So what fills the gap in absence of a engaging IRL opportunity to explore your interests and do all the things. The survey also said that nearly 9 in 10 parents support public funding for these programs. And in our most recent national poll, which I will say is not that recent anymore, we need to re-up it, but we asked where voters want to see their tax dollars go, and youth mental health was the very top issue, even above early childhood and other things, which are, quite popular as well. Coming through COVID and all these things, youth mental health is top of mind for everybody. So really, upstream investments in youth mental health they're missing from the conversation sometimes about solutions to, what's happening with social media and youth mental harms. Sometimes the solutions are focused on digital solutions or digital literacy type training, or even the physical bags that lock up phones. And I think it's all of our jobs to just remind people that the antidote to some of these harms is these things that we're just not investing in a real way across the board in our country, these upstream interventions.
Yeah. Thanks for that, Allie. As you talk about it, I've read a couple of great blog posts on Substack, and putting phones down is insufficient, right? It is one step, right? I need to do this. I know for educators, it is there's a lot to all of that, right? And figuring that out. And what else? What is next then? What does that mean? How do we fill that? Because again, many of our young people, this has been what they have been engaged on for much of their lifetime. So how do we fill that? Allison, what are your thoughts on this? How do we really make investments in youth mental health? I mean, this is what you are doing, right? Getting people to get on this bandwagon. How do you make this really compelling for folks?
Yeah, no, I start by zooming out. So I think we have to zoom out and first think about mental health in particular. So not just about youth, but what we saw coming out of the pandemic was that there was all of a sudden this awareness, right, around mental health, that every person has mental health. We can have good mental health or we can have poor mental health. And how do we have tools and supports and care surrounding all of that? And we know now that 90% of Americans agree that mental health is something that needs to be addressed. So there's broad awareness of the issue. And then if we start to drill down into youth, we see that this is a bipartisan issue. So in a time where there's a lot of differing perspectives, there's polarization, back to what I said earlier, that we all know a youth that is like in our inner circle or a neighbor, and that this is really a bipartisan issue. I was in DC last week having conversations about this. And then finally, just to think about where there's some discrepancies in the investment opportunities, right? So everyone here probably knows the data, right? That in 2023, 40%.
Oops. I think we lost Allison for a moment. I think she's frozen.
Dramatically increased over the last 2 decades. And so the prevention infrastructure is fragmented, it's underfunded, and yet the upstream investment is incredibly compelling. The National Academies, I don't know if you guys saw a recent draft of their upstream investment, but they talked about that the cost right now is about the prevention package is about $218 per child compared with a $4,300 per child investment on treatment focused approaches. So that, I mean, we think about like just investing $218 per child in prevention versus spending over $4,000 on the downstream. That ROI is huge, right? Even if we just think about the initial investment, not to think about the outcomes. We know it can be challenging to track from an outcomes perspective. The timeline horizon is really long. But I think that there's a really compelling case that we can make and that we are making around those initial dollars and where they can invest into the building blocks that I talked about earlier. So we're really trying to make that case about shifting the systems from reactive to preventive, supporting the long-term flourishing rather than short-term crisis, and to help communities build the infrastructure that's necessary.
Yeah, love that. And we will make sure the different reports that people are mentioning, we'll collect these from our presenters and we'll send links as a follow-up. Allison, you were mentioning a 2023 finding and you froze for just a moment. Can you just speak to what that 2023 finding was again?
Yeah, and we can send the citation later, but it's 40% of high school students in the United States report persistent feelings of sadness or hopelessness. And I've witnessed this firsthand in, the communities of youth that I get to serve as an Eagle Scout coach, and I get to serve in a lot of different communities with my children and teens. And I've witnessed this firsthand, and hearing them report back conversations they're having with friends and, people at school and even in college. So I've witnessed the statistic, unfortunately, firsthand. And again, I just go back to we have a responsibility to do better.
Yeah. So as I've listened to both Allie and Ellison on this, you've talked about we have a moment in time here right now that we are in, which is huge. We have an experience that most people have some sort of connection to, right? Whether it was something that was a struggle for them personally, or they watched their neighbor or their child go through. And we have the data, we have the information that shows, that makes the case. It's really unique to have kind of all three legs of that stool. And I hope that as folks are on this webinar, part of what we also wanted to do is give you all tools, right? To think about the message, to hear how people are talking about this, to be able to make the case in wherever you are. Chris, is there anything you'd add to that conversation around this case making?
Yes. And so, as you think about the times we're in with scarcity of resources and this connection that people do feel to the issues, I mean, we can all agree on the importance of the issue. We get to the thought about quality and what is going to be effective with the use of the dollars that are so scarce and also people's time within these systems that is so fraught. And so fostering collaboration and dissemination of information are both really important because in funding our direct services, when we do that, we often find needs for capacity building and technical assistance that can be handled quite nicely through partnerships. For example, we'll have organizations that have already got mental health expertise, but they're seeking to expand upon those services or referral opportunities, and they need to be able to have those who are in the field in non-mental health settings have a better understanding of what might represent typical development and what might represent the need for referral to services. Also, what are these therapeutic things that in particular dosages can provide the kind of healing from the adverse childhood experiences or the chronic effects of chronic stress? And so this need for education and being able to think about if we wrap around understanding behaviors that we're seeing within a child's day or week or how they interact, things that might be limiting in terms of their ability to form relationships or achieve within school or feel safe or even affecting their medical health at times. How are we looking at those phenomena and how are we labeling them? Are we really giving it a 360 view where others who have different ways of seeing the same thing are in conversation? Additionally, a point I really like to raise up that collaboration and fostering that really can add in terms of quality of what happens is the idea that we are in these silos of different disciplines. And so as a mental health professional who understands clinical intervention and ethics around the provision of mental health services, when we have organizations that may want to provide things that are therapeutic, referral to services, or dabble into the area of direct service provision, the need for developing clinical understandings, understanding ethical mandates, administrative processes, risk management, sustainability factors, all kinds of things about quality. When we partner together and we are able to see what is known and what is the desired outcome, we can help create pathways of learning for implementing programs that are sustainable, have value, and do not cause harm inadvertently. And so it takes all of us from our various vantage points understanding, hey, I'm a clinician. I don't really know what goes on in schools. And when I come in there, it's a host environment for me. But when you have me, do you understand my field enough to make use of the services such that they benefit the children and work toward these greater outcomes that we all share an interest in? So I think this collaborative time that we have with such scarcity and wanting to make the most of the dollars really allows there to be a good basis for having these conversations across sectors.
I appreciate where you took that conversation, Chris, because in times of scarcity, we can either all hunker down and try to like protect ourselves and our thing and our piece or our organization, or we can say, okay, how is this calling us to work differently? What does this look like? How, if I'm working well with other folks, what does this mean? And what more can we do? So, and that's definitely been huge with our experience with Chiron. So we'll shift the conversation a bit. We've talked so much about the critical nature of relationships and connections, right? And we know those are just absolutely fundamental to our well-being as human beings. It's how, for the most part, we are hardwired, right? What we need to thrive, and we know about the research around brain development in early childhood, and we know there's another whole wave of it in adolescence, and certainly this power of relationships and connections in adolescence. That's what drove us. Actually, what got our research partner, Dr. Joe Allen from University of Virginia, he came to us and said, "Hey, I've got this idea, and here's why it's important to me because of that power of relationships and connections for this time period. Do you want to work with me on this?" It's been a great journey in that space. So I really want to hone in on this idea of relationships and social connections with the reality that our young people are, and those who care for them, are growing up within systems. We interact within systems. Those systems can help, those systems can hinder, those systems can cause harm, those systems can be proactive. So really want to open this up to, how are you thinking about the role of relationships and connections, and the role of systems, right, in as part of that dynamic. Allison, I want to bump this to you first, because I know when we were prepping for this, this was a space where you had some real energy around.
Yeah, thank you, Allison. It really is interesting right now, the like to our previous question, the moment we're in. And I think there's a growing realization that mental health doesn't happen in isolation. We used to say that mental health kind of cuts across all of these different issue areas like education and poverty and, housing and things like that. But I'm thinking about it a little bit differently now, and I'm thinking about it as mental health is this place where all of these systems converge, especially around young people, right? Young people develop within systems, whether it's, a family system, an education system, and a school system, a neighborhood, a digital environment is a system, a peer network, all of these different systems are places where they mental health converges. And if we start to think about it a little bit differently, there was the recent scorecard that was released around education, and I think all of us are taking a look at these different systems and saying, okay, how do we need to think differently? We're not getting the outcomes that we're hoping for, that we're trying to achieve. So what if we reframe things and think about the outcomes that we want to see for youth? Long term. And then we start thinking about, those environments and those systems that really protect youth and that they're engaging with every day. And things like schools and parks, sports programs, arts, organizations that we've talked about, and help them not operate in silos where they might be competing, as Chris just mentioned, for limited resources, there's scarcity. And they're not treated as extras, right? Where that drives even more scarcity mentality. But they're actually essential parts of development for kids, right? And that delivery, mechanism.
Oh, got Allison's frozen again for a moment. We'll give her a moment to see if she pops back in. Let me bump over Allie or Chris. Do you want to weigh in on this? And then we'll hopefully come back to Allison
Freeze
when the
out.
internet. Oh, there she is.
There
I'm
we go.
sorry.
I'm so sorry.
No, you're okay. You froze again for a moment, Allison. So maybe go back about 30 seconds and finish your thought there.
Apologies for that. I know we're having in New York City some issues today. So I was just saying that, these systems can either operate in silos and compete for limited resources, or they can be treated, as extras, rather than essential parts of healthy development. And so we want to think of these as relationship ecosystems, right? That we are the systems that relationships are in can either create and foster belonging and connection or fragmentation and isolation. We get to choose and we get to design the systems, but let's design them with a focus on the relationships. And so for mindful, we're thinking about how do we strengthen the connective tissue between the systems of education, early relational health, the medical care system, housing, and how do we all converge around these outcomes that we all want, right? We just have to re-engineer the way that we get there.
Thank you. I love that lifting up of relationship ecosystems and thinking about this reframing and how do we take this moment in time to think differently and come back to the basics of what we know is absolutely powerful. Allie or Chris, anything you want to add as you think about relationships, connections, systems? Any observations on this?
While you were just talking, Allison, it made me think of this initiative in Spokane, Washington that I'm such a big fan of and kind of inspired our name of Fund IRL. It's called Engage in Real Life, Engage IRL. And it's a system that was built around relationships, exactly what we're saying. So basically, in the community, they were seeing sort of alarming rates of suicide rates increasing among young people and disengagement in school and such. So the school district and a local community intermediary organization partnered to start this initiative called Engage in Real Life and really Engage IRL, really doubled down on saying, let's make sure every single young person in our community is engaged in an extracurricular activity or something that interests them every week, and let's see how that impacts all of the other outcomes we're looking at in terms of academic outcomes, all of these other things. So they really went deep on this and got some pushback being like, well, why aren't we investing more in French or, these other things like academic topics? But they went deep on this and built a whole system around it. So a whole, you know, uh, system of navigators. So near peer folks to connect young people to opportunities that excited them, cultural centers. There's a whole database to help identify opportunities to get engaged in. And, um, so many partnerships, both from between the district and community-based organizations and other systems. And sure enough, they're seeing really amazing outcomes, yes, in mental health, but also in academic outcomes and all of these other things. So really leaning into the relationship part of it kind of had all these ripple effects in all of these other systems. And why we're so passionate about dedicated funding streams for children and youth programs and services is yes, because funding is needed in almost all cases, but also because it creates an infrastructure or a local cross-sector, infrastructure to make those connections across systems and have people that whole full-time job is to be thinking about investments that are being made in young people in the community, needs of young people in the community, and making sure sort of all of the surrounding systems are on board to some shared goals. So creating these sort of voter approved funds is one mechanism to do that. There's other ways to do that as well. People do, children's cabinets or child-friendly cities or all of these different models, but sort of having that that backbone, that infrastructure, I think is such a need too.
When you talked about that program, I think I saw it on the Fund IRL, or maybe I heard about it on your webinar recently. So I went on and investigated and watched a little bit, and they did exactly what Allison was talking about, right? They created a relationship ecosystem, and a lot of that was experiences that are already in the community. It's about being intentional to ensure that every young person then was connected in that space. So not only did they center on relationships, but you think about that, it's such a smart investment in terms of making sure opportunities for kids don't go to waste, don't go unused, right? And ensuring that they're being reached. So that was such a great example. Chris, anything you would add in this space?
Well, absolutely. And so I wanted to kind of point out we have parallel processes of connection that are so important in the work. As we have professionals who are being trained, often they're learning in programs locally that have to do with ecological counseling models or models of somehow being connected with others in the community as the value of the program. But then we look at what research has uncovered that we've got people who cannot maintain and sustain careers in our region for many economic reasons or burnout reasons and so on. And so we know that to sustain the workforce is to also sustain the ability for the youth connection to happen, that changes individual youth lives, right? And so when we think about how our investment can be strategic in this way, one of the things that we do, as I mentioned before, is to bring people together to learn. And I want to put a little plug here for those who are St. Louis based that this coming October, on October 3rd, we are sponsoring a community convening where Dr. Bruce Perry will have his return to the region. And many will remember when he was in St. Louis before, it was right about the time that just before trauma-informed schools funding was approved, and many of the people on this call had a huge hand in creating trauma-informed spaces. And so I look at it as a wonderful opportunity to showcase for Dr. Perry some of the influence that his work has had. For those who may not know, he is the person who developed the neurosequential model of therapeutics, which is a very important clinical model for looking at behaviors and what occurred during early development for youth that can be mitigated through these therapeutic ways of interacting. And so equally important is the information that Dr. Perry provides for people who are in non-clinical roles. And in his work, he talks a great deal about the importance of relational health. His core message is that relationships are the primary buffer against adversity. And he often says relationships are the agents of change. So from his perspective, young people develop resilience, which we all talk about in our youth services and education circles. But when they experience safe, stable, attuned relationships with adults, peers, families, and communities, and ultimately, if we have youth feeling connected at an earlier stage, they are more likely to be able to continue that connection, ask for help when needed, and engage others in help-seeking behavior and identify when something might be wrong. And so since we know that for older youth, between the ages of 19 to 26 in Missouri tends to be the age of first birth, and in 0 to 4, what is occurring during that period of rapid development, if we are able to have an attuned adult with an early childhood baby, young toddler, and that ability for someone to be connected is fostered through things like Wyman's TCP program and other upstream supports, we are then able to impact the transgenerational transmission of trauma by having two lives or a family's life within that system change. So when you put these perspectives together that we're all sharing, thinking about reasons to come together on a Saturday to hear Dr. Perry talking about the use of his work for systems change, but knowing that we're still talking about that young child, their brain, and that we each only get one, poorly understood though it may be for children, parents, educators, like how this thing that guides our behavior is kept well is really an important focus.
Yeah. Tremendous. There is so much in that space of what you just talked about, Chris. And I do encourage folks who are in St. Louis. Chiron does great convenings, and Chris means it when she says, "Watch for it and sign up." When you talk about that, relationships are the agent of change. I mean, that again is the piece across systems. Whether I am a teacher, whether I am a counselor, whether I'm a probation officer, whatever my role. A key part of that is I have relationships with young people, right? We've seen in our own work when we've gone back and really looked, done a deep dive into what young people are reporting in terms of outcomes and what they're reporting in terms of their experience with facilitators and their sense of safety in programs. Should be no surprise to anyone on here. Young people who have the strongest relationships and young people who actually feel safe and cared for in that program environment, those are the young people who have the strongest outcomes, right? So you're also talking about fundamental pieces that we can address throughout within systems. So we are going to, in just a moment, we are going to pop over and Jillian's going to help share some questions from the audience. So if the folks on this, if you have a key question, please go ahead and pop it in the chat and Jillian will share a couple of those in about 5 minutes. But to wrap this section from each of you, would love to give you about a minute to to share with us. We know, again, we're in such uncertain times. We know, day to day, I wake up and, you never know exactly what you're going to be dealing with, right? What you're going to see on the news, what you're going to be dealing with from an organizational perspective, what really hard thing has happened again. How do you sustain momentum? How do you each, as leaders and folks who care in this space, sustain your momentum and sustain your focus? Let's see, I'm going to work backwards this time. Chris, I'm going to start with you.
Well, everyone who's been in any of the wonderful times that we've spent together in training, I will say I'm always one for a good quote, because there's such wisdom. And so, I mean, how do we sustain? We talk to folks at Wyman who give us hope, and they use that word every single day. And we drink coffee out of mugs that say, "Don't you dare give up." And we do these things to boost ourselves, but also the wisdom in folks like Pima Chodron or Parker Palmer, or in this case, Clarissa Pinkola Estes. I want to share this quote. We've all heard it perhaps. "My friends, do not lose heart. We, and I emphasize we here, were made for these times." She goes on to say, "Ours is not the task of fixing the entire world all at once, but of stretching out to mend the part of the world that is within our reach. Any small, calm thing that one soul can do to help another soul to assist some portion of this poor suffering world will help immensely." And so remembering our locus of control and the word we within that to bolster each other.
Beautiful. Thank you, Chris. We'll make sure we get that quote to be able to share out with folks. Allie, how about you? How do you sustain yourself?
You're gonna make me follow that. That was so that was so beautiful. So yeah, I mean, I think that's what's so powerful. I think hope is the most powerful thing in the world, and that's what this this Fund IRL initiative, where we're trying to look towards what could be billions of dollars to invest in what young people need. Like when as a field are we ever looking to billions of dollars and dreaming about where it could go? We're often defending or trying to get a little bit more in terms of investing in these programs. We have this opportunity to say whether it happens or not, and I have reason to believe we will start to see payouts and settlements from these lawsuits, because we've already seen a few from Roblox settlements and what's happening in New Mexico trials and everything. Whether it happens or not, we have an opportunity to listen to young people, engage in young people about if there were billions of dollars coming into your community for your mental health, where would you want to see it to go? And then an opportunity to link arms together across areas that we might not traditionally have done. When we first kind of started building this Fund IRL coalition, like the after school organizations in the coalition, the nature organizations, like not everyone was seeing themselves as a mental health, you know, effort or body. And the mental health organizations we were working with didn't already have relationships with some of the other types of organizations. So just having something hopeful to work towards, to build our muscles in a different way, build relationships among organizations and individuals in the field, and listen to young people in a way that feels like it could lead to real investments, has been what's sustaining me through these wild times.
Yeah. Thanks, Allie. Allie touched on one of my favorite words, hope. That's a story for another time. Why I wear a hope shirt almost every day that I can. Allison, how would you wrap us up in that space?
Yeah, I mean, I think acknowledging that it's a challenge to hold the tension between, the urgency of where funding needs to go. We get emails weekly with, organizations that have had huge cuts and maybe they're operating at deficits, and it's challenging to hear those stories. But we have to hold that tension of, urgently funding things and holding out kind of hope and a vision of the long horizon of how we start to implement better systems and do better by youth. And then I just want to go back to what Chris said earlier around collaboration. When we put collaboration, we kind of strip down the egos and we put collaboration at the forefront. We can be so much more effective and impactful with the dollars. And it's when all the different people with all the different lenses come together, and operating in parallel, that we can see that change actually happen within systems. And then I go back to the conversations that I have daily with youth and grounding in those conversations that behind the statistics, the dollars, the cuts, like whatever is happening on that day, that it's about, that child, their story, their life, their desire for belonging and connection and to truly flourish. And that keeps me grounded. It helps me think about, what do I need to do today and what can I do? Think about the next generation as well.
Thank you, Allison. I love that. And one of our follow-ups to you all is we will be sharing the link that you saw earlier with our young people talking about teen mental health. I keep a couple of our videos on my desktop, and there are those days that I just need to go on and watch that, and it regrounds me, right, in what I'm doing and what I need to do. So we are at the time and space where we're going to take some questions that our community who's come together have for us. Jillian, can you share our first one for us?
Yes, absolutely. And I dropped this in the chat as well, just because I realized as folks are sending in questions, you can either send to everyone or just the panelists and hosts. I can see them both, so don't stress if you didn't see yours come through. So first, Allison Neiman, since you just wrapped us up, someone dropped a question in the chat around wanting to know more about this blueprint for philanthropic investment that's coming out this month. Is it going to be upstream investment specific? We'd love to hear more about that.
Yeah, thank you, Jillian, and thank you for the question. So it actually will be launched tomorrow. We have a webinar of our own where we are doing a deeper dive into the blueprint. It's for philanthropic funders, so it's not open to everyone. But if you're a funder and you want to dive in, and this is actually kicking off a 10-session learning journey. So we're not just throwing the blueprint out there. The goal is that a few days after the webinar, you'll get the blueprint in your inbox. And then we're going to roll up our sleeves and get to work within the philanthropic community. So we'll do 10 sessions together, diving into the blueprint and learning how to activate the blueprint in the three areas that I talked about earlier: strong start to life, play and grow, and digital well-being. And we already have over 70 people signed up to do the 10-week course. And if you're interested in becoming a part of that learning cohort, and figuring out how to actually apply the blueprint to your philanthropic portfolio, you can reach out to me. It's Allison, my name, at Mindful Philanthropy, and I'll make sure you get set up with our team to do that. But we're excited potentially about just the collaboration that I talked about, the co-funding and aligned funding that we hope will come out of this around the blueprint.
Well, thanks, Allison. Jillian, what's next?
Yeah, so a couple different themes here. One is around, so you all have mentioned this a little bit, but even with kind of limited resources, right? What's a practical step that folks can take right now to support youth mental health, whether that's individually or via their community work?
Chris?
Well, I just want to put a plug for the simplest and most direct way. We talk about all the systems and we talk about supporting organizations and systems change and this and that. But at the point of interaction with youth, I think grasping onto looking at it from a child perspective and that young person's day-to-day life, how are they engaged in what Bruce Perry talks about, these 5 R's: the relaxing, rhythmic, repetitive activities with a high reward that are done in relationship with others. And so it's about seeing the person in front of you and thinking about the dosage, as we say in the field, right? Of how many opportunities within their busy life. I mean, they may be working at school, working at a job, working at sports, working at whatever, survival in their neighborhood, just trying to stay safe, taking care of family, all these things. But when we see each other and we're able to think about how this system can regulate with co-regulation with someone else, we pick up on these programmatic things that are happening through programs like TCP and others, right? In the day-to-day life of kids who may not have that support elsewhere. So just keeping it real with the neighbor, with the person in the congregation or at the school or whoever that may be, and thinking about engagement with those who have the opportunity or time to connect.
Thanks, Chris. Jillian, how about another question?
Another theme that I'm seeing here is around folks' inputs or thoughts around kind of balancing the urgency of immediate youth mental health needs versus kind of this upstream prevention approach.
So that balance, it absolutely is a both and here, right? Who would like to jump in around that or thoughts on that? It's that dynamic tension that Allison, I think you were talking about earlier, right?
Yeah, this is a really hard one. And I know that a lot of funders are wrestling with this right now. I come back to, um, one of the things that I think we were just talking about not too long ago as a team is if you have to make investments in kind of that urgent right now, think about where the dollars are dropping off around critical infrastructure things, such as like data that has long been a North Star or an underpinning for some of the work. We know that some of the data is some of the funding is being pulled around that. So how can you think about investing in data, the things that are going to be create trust in the systems? And then thinking about where you can pull funding, collaborate with local funders to support those critical needs and getting above the spending threshold that maybe you get your approval from your boards and trustees to maybe go above and beyond what you might typically be doing. And then I think on the prevention and the upstream, start to think again about your portfolio. And we're seeing funders be more intentional. If they are supporting criminal justice, education, and families, how can they actually think about putting that under an umbrella of a mental health strategy where the dollars in the strategy might create more synergy, right, between how those dollars go further. So going back to that relational ecosystem piece, and doing it actually within your own foundation or your family offices and thinking about where the portfolio can be better synergized so that as you're thinking about those upstream and the redesign of systems and thinking about them from that relationship ecosystem perspective we talked about, those dollars are going to go further. So I think those are just maybe two quick things like redesigning your portfolio, thinking internally about your own house, your own foundation, whatever, and then thinking about where you can collaborate with local funders and actors around some of those urgent requests.
Allison, as you talked about that, I also, think about then that how we continue redefining the relationship between like private philanthropy and in particular and the practitioners, right? And the organizations that are being funded. We talk a lot about trust-based philanthropy, what that looks like, how that continues to evolve. And I think the more that we continue to evolve our relationships, right, as part, because we both have this same goal, right, that there's so much that can be uncovered in that space as we continue to find ways to work differently together.
And Allison, if I can just jump in, I saw one thing come in that maybe is a double click on what I just said. But one thing we are doing that people, if your funders can get involved in, is there are funding tables or collaborations in each state. Right now, it's about 20 states that are mental health funder collaboratives. And then sometimes they're broader as mental health stakeholder collaboratives, but there is typically a core of funders that are funding the work, standing up the backbone for it. Until 2 years ago, those funder collaboratives in the states did not know each other. So Georgia didn't know, Washington, Texas didn't know, Louisiana. And so put them together in something called a collaborative action network. They meet quarterly, they share resources. So, if Georgia has done a state roadmap on youth mental health and they're working with their legislators to enact that state roadmap, they're now sharing that roadmap across state lines. And other states are taking it to their legislators and saying, hey, we've adapted this for our context. And so that's a practical way that people can get involved in the work. is thinking about it from a state level. So I know in the local, and I'm from Oklahoma, so there's a local Oklahoma philanthropic collaborative, and then in Missouri and others that are in the process of forming as well. And so that's something that funders can help do right now.
I love that. Chris?
I just want to give a shout out to people who are on this call. It was mentioned earlier, Children's Services Fund work, the Mental Health Board's work. We are seeing new and innovative collaboration amongst the funders who are very interested in looking at mental health care systems and change through a variety of lenses, including our St. Louis Community Foundation, the United Way of St. Louis, and the Mental Health Board, formally pulling together a group that is a leadership roundtable that they're utilizing to leverage system of care work that's been going on for a very long time. And so when people are looking to understand the ecosystem and what supports and services may be changing, these pillar foundations within our community have deep information, resources in terms of information and statistics, data, connections, ideas about future programming. I think sometimes letting people know what you're doing and what your interest is not necessarily via a formal funding ask, but sometimes asking about, what is going on with the changes in the formulas or what's on the ballot for funding of, our income tax or our property taxes and what the revenue changes might do if this passes or that, so that we can be informed and kind of all start rowing up the stream in the same direction in our conversations, and whether we're positioned to take an advocacy public stance or not. It gets complicated when we think about our donor bases in some of the nonprofit arena. So, I think if you're not the one to formally be able to publicly say something or take action or do something, being informed is still very important, and looking to these institutions that have invested a lot in understanding what's going on around us can be a very easy step, as quick as asking for a report or a cup of coffee with a staff member.
Love that, Chris. My team will laugh because I talk about the 150 cups of coffee or tea that I have a year, whether it's virtually or in person. And sometimes it's just about, hey, there you go. Here's what's on my mind. Here's what we're thinking about. What are you thinking about? Where are the connections? Where is the overlap? It really can be profound. Well, I see in the chat, I love that I see some people asking questions and other people replying, and here's some resources. We are getting close to the end of our time, so I want to make sure we wrap this up together. Let me ask, each panelist just quickly, if there's one thing that you want to leave with the folks who are on this call, one thing that really resonated with you from today, one thing that is your piece that you always share with folks, what is that? What would you want to leave people with? Allie, how about if I start with you?
Yes. Well, I think please join us in the Fund IRL Coalition. But the note I want to leave is to, when we're talking about relationships and helping young people foster relationships, we also need to be thinking, about our own relationships in this work and maybe non-traditional partners that have actually similar goals, but that we haven't, necessarily seen as a partner before. So kind of alluding to what Chris was just talking about, like thinking about going to sort of more tax budget revenue focused organizations in your state, like your state's tax and budget center or whatever it is, who are trying to work on big revenue pushes or tax reforms, and actually could be a great ally for tying those movements to youth mental health programs. And, we have this winning issue and can bring it to other people who are thinking about investments and how we're paying for things in our country. Partnering with early childhood folks about, sustainable funding along the spectrum as kids are growing up. So that's what I leave. Just think about our own relationships and maybe partnerships we haven't put a lot of energy into yet, but could be really fruitful.
Relationships are the agents of change, Chris reminded us earlier. Allison, how about you? What do you want to leave people with?
I keep coming back to what calls me forward in the work, which is the belief that flourishing is, it should not be the exception, but the expectation for young people. That they need joy and relationships and creativity and purpose and play and connection, that those really aren't secondary outcomes. They are the foundation to well-being. And that intentionally investing in the relationships and the upstream, the environments and systems, we will truly be able to ensure that promise to the next generation.
Thank you, Allison. Yes.
Yeah, I want to say two things. One is as you do the work of providing these upstream supports, engage with someone who can help you to further define your why, either using the evidence base or in terms of the adolescent development and the psychological benefits, in terms that match what your audiences need to hear. We see a lot of applications that come through where people are still giving us, X% of people in the United States have a mental health issue, right? And what we are trying to surface through the research opportunities that we provide is the idea that people who have sought care and people who deliver care actually have a local experience that's contextualized in the traumas that were mentioned earlier, in COVID, response and all these things. Like, what is today's information and how is your work making that change occur within an individual or the possibility of that change, right? And the second thing I would say is check out the chat where my wonderful colleague, Nikki Martinez from Community Foundation has put a plug for Webster University's convening and Dr. Bruce Perry, if you want to learn more about it. There's an info email that we can connect you to our mailing list. It is hosted by Webster and sponsored by Chiron, so it's really something that they do at the university at this point. And I just want to call your attention to that. So we'll see you hopefully again.
Wonderful. Thank you, Chris. Well, as we wrap today, just huge gratitude to Allison, Ellie, Chris, to each of you for your generosity of time, for your leadership, for your just all of the gems and all of the pieces of wisdom that came through today. And to our community who's gathered here with us today. So we're going to put up, Caitlin, we have something for everyone. Yes. So hang tight, everyone.
Hang tight. Decided
you want to see this.
Yes.
This is our gift to you. As Caitlin works to pull this up, we will be getting a follow-up out to everyone who's registered for this. We have it recorded. We will make sure we bring together all the resources folks have shared. And we will be sharing with you what this community created. So this is the word cloud that came out of the words that you entered early on about why you do the work you do, about why you connect to teen mental health. And if you recall from word clouds, the bigger the word, the more often it was mentioned. Allie, there you go. You talked about hope earlier, right? It is the biggest word that's on there. Young people, their future, how vital all of this is. So this is one of those pieces that you could print out. You can do the old-fashioned print it out and actually put it on your wall next to you when you need that reminder. So we will be getting pieces out to all of you. And I do want to give a plug for our next connected conversation that we're going to be doing. So you all will receive an invitation to this as well. It will be on August 13th from 9 to 10:30. And actually one of our community members, Stephanie Malia Kraus, who's on the call with us today, is going to be our panelist. Something else that you can do now is find this amazing book, How We Thrive, Caring for Our Kids and Ourselves in a Changing World. This was a true labor of love that Stephanie has put together over the last couple of years, and it comes from research and young people and practitioners, and it really is about, Allison, how you summed this up for us, right? Like that, what it means to flourish and what every young person should should be able to experience. So more to come on that. You'll see that invitation. We'd love to have you all with us. So thank you so much to each of you for the amazing work that you do every day. Super deep gratitude to our panelists for your generous gift of time and for your leadership. And may we all today and every day continue to move onward with hope. Gratitude. All right. Caitlin, are we done recording?
Allison, you can just hit end whenever you're ready.
I just saw it there.